Honorable members, I just wish to bring it to your attention that on the 26th of March, a communication was sent out from the Speaker to all members, and that communication was based on a meeting where the member for Kalani was a participant, the member for Cat Island, Rumkey and San Salvador was a participant, and the Speaker was a participant. And this was the agreement that was sent out from the Speaker's chair to all parliamentarians on the 26th of March, and subsequent to that date, with respect to dealing with resolutions related to this COVID-19 pandemic, all meetings of this chamber followed that agreement. And that agreement says, with respect to speeches on the resolution, it was unanimously agreed that the mover, the lead presenter, and the closer will speak for 25 minutes. The two opposition members will be allowed 20 minutes each, and all members will speak, all other members will speak for 10 minutes. It was agreed that the House debate be wrapped up and the resolution be passed by 2 p.m. and that resolution be immediately sent to the Senate for passing. Subsequent to this notice, the chair was not informed until just a moment ago that this agreement was no longer in place. All other meetings, honorable member, all other meetings subsequent to that date followed that agreement. And so, if there is no agreement or this agreement no longer stands, then the Rule 46.3 says that the agreement should be by all parties concerned. And so the chair position is, if there is no longer an agreement, or this agreement no longer pertains, which, by the way, did exclude the independent members, and I had to convey that position to them, and they subsequently agreed. Then if we want to resort to the rules outside of this agreement, then of course the House is in a position to regulate its own affairs and revert to that rule. But as far as the chair is concerned, the chair was functioning under this rule or this agreement that was reached among the parties. The chair recognizes the honorable member for Cat Island, Rumkey, and San Salvador.
Operated on that premise, then the chair was under a misapprehension. And I say that for this reason. It's correct that when we came last, we operated primarily on this basis, but the parties had spoken and agreed on that position.
So what your communication is to me now, that on each and every occasion subsequent to the 26th of March, there was a subsequent agreement.
Yeah, what I'm saying, Mr. Speaker, is that the agreement to which you referred spoke only to the resolution and the proceedings of that day, and it's clear. I mean, I have your note to me where you memorialized the meeting that we had by phone, and it spoke primarily to what was occurring on that day. Nothing further, nothing more. Now,
so, honorable member,
yes,
before we proceed any further, so your position then is
there's no agreement.
That there was no agreement subsequent to that day, despite the Parliament functioning according to that agreement in the subsequent meetings?
No agreement
No,
today.
Speaker, there's no agreement today. That's what
That's what I'm saying. I was only recently informed of that fact.
yes, I'm saying. But,
Informed just now, maybe.
okay, very well, Mr. Speaker. If you are just recently, there's no agreement today. And therefore, we revert to the rules
Just
as
to
it
be
is.
right there.
The chair recognizes the honorable member for Kalani.
Yes, Mr. Speaker. Mr. Speaker, the opposition leader and myself would have had discussion, and he would have agreed that we can proceed once I table the resolution. We can proceed with the debate, and therefore, Mr. Speaker, I move to follow through with that agreement to debate the following resolution. Resolution as follows, Mr. Speaker. Whereas pursuant to Article 29(1) of the Constitution, the Governor General make a proclamation of emergency herein after the proclamation dated the 17th day of March 2020, declaring that a state of public emergency exists in the Bahamas. I will be reading the resolution.
Honorable member.
Oh, you have to be consent. Sorry.
The motion for the, you want a motion for the consent?
Yes, okay, yeah.
Yes.
Mr. Speaker, well, the Prime Minister has put the motion on the floor. And it's been seconded by
Yes.
the Minister for Health. So now we just need to put
Yes,
it on.
thank you. Honorable members, it has been moved and seconded that the resolution be debated today by, it has been agreed by all parties that the notice requirement is waived, and so the House can proceed to debating the resolution today. As many as are in favor will remain seated. Those who oppose will stand. The debate on the resolution will proceed. The motion is agreed. The debate on the resolution will proceed today. The chair recognizes the honorable member for Kalani.
Thank you, Mr. Speaker. I will continue. And whereas pursuant to Article 29(4) of the Constitution, the proclamation ceases to be in force at the expiration of a period of 14 days beginning on the date on which it was, or such longer period as may be provided under paragraph 5 of Article 29 of the Constitution. And whereas Article 29(5) of the Constitution provides for the continuance in force of a proclamation if at any time while the proclamation is in force a resolution is passed by each House of Parliament approving its continuance in force for a further period not exceeding 6 months beginning on the date on which it would otherwise expire. The proclamation shall, if not sooner revoked, continue in force for that further period. And whereas, pursuant to Article 29(5) of the Constitution, a resolution hereinafter, the first resolution, was passed by each House of Parliament on the 30th day of March 2020, which approved the continuance in force of the proclamation for a further period of 8 days until the 8th day of April 2020. And whereas, pursuant to Article 29(5) of the Constitution, a resolution hereinafter, the second resolution, was passed by each House of Parliament on the 6th day of April 2020, which approved the continuance in force of the proclamation for a further period of 22 days until the 30th day of April 2020. And whereas, pursuant to Section 31 of the Emergency Powers Act, Chapter 34, hereinafter the Act, the Governor General made the Emergency Powers COVID-19 Regulations 2020 on the 17th day of March 2020. And whereas Section 3.3 of the Act provides the emergency regulation may empower such authorities or persons as may be specified in the regulations to make orders and rules for any of the purposes for which such regulations are authorized by this Act to be made and may contain such incidental and supplementary provisions as appear to the Governor General to be necessary or expedient for the purposes of the regulation. And whereas Emergency Powers COVID-19 Regulation 2020 empowers the competent authority to make such orders, and the Emergency Powers COVID-19 No. 2 Order 2020 was made by the competent authority on the 23rd day of March 2020. And whereas Section 5.1 of the Act provides that all emergency regulations, if sooner revoked, shall cease to have effect when the proclamation of emergency is pursuant of which they have been made ceases to have effect. And whereas pursuant to Section 5.2 of the Act, by the first resolution, each House of Parliament affirmed the continuance in effect of the Emergency Powers COVID-19 Regulation 2020 and Emergency Powers COVID-19 No. 2 Order 2020. And whereas pursuant to the Emergency Powers COVID-19 Regulations 2020, on the 30th day of March 2020, the competent authority made the Emergency Powers COVID-19 Special Provisions Act 2020. And whereas pursuant to Section 5.2 of the Act, by the second resolution, each House of Parliament affirmed continuance in effect of the Emergency Powers COVID-19 Regulations 2020, the Emergency Powers COVID-19 No. 2 Order 2020, and the Emergency Powers COVID-19 Special Provisions Order 2020. And whereas the existence of a state of public emergency in the Bahamas as a result of the presence and effect of COVID-19 in the Bahamas continues, and whereas it continues to be necessary and expedient for securing the public safety, defense of the Bahamas, the maintenance of public order, suppression of mutiny, rebellion, and riot, and for maintaining supplies and services essential to the life and well-being of the community to continue in force the Emergency Powers COVID-19 Regulations 2020, the Emergency Powers COVID-19 No. 2 Order 2020, and the Emergency Powers COVID-19 Special Provisions Order 2020. Now, therefore, be it resolved that this House, A, approve the continuance of the proclamation made on the 17th day of March 2020 until the 30th day of May 2020. B, affirms the continuance in effect of the Emergency Powers COVID-19 Regulations 2020 made on the 17th day of March 2020 until the 30th day of May 2020. C, affirms the continuance in effect of the Emergency Powers COVID-19 No. 2 Order 2020 made on the 23rd day of March 2020 until the 30th day of May 2020. And D, affirms the continuance in effect of the Emergency Powers COVID-19 Special Provisions Order 2020 made on the 30th day of March 2020 until the 30th day of May 2020. Mr. Speaker, I would only have one or two words with respect to the resolution, and I would only want to remind the Bahamian public that we are fighting a battle, a war, with an invisible enemy, and we must all fight this together. We must demonstrate solidarity, we must demonstrate unity, and we must demonstrate that we are one Bahamas, not divided, and we will conquer this enemy, after which we can return to our normal life. And to demonstrate unity, solidarity, and to demonstrate that we are one Bahamas who will win this battle and will comply with the emergency orders, I ask and request that all Bahamians tomorrow wear some clothing depicting the colors of the Bahamian flag. That in itself, Mr. Speaker, will truly demonstrate solidarity and unity. I so move.
Thank you, Honourable Member. seconded. The chair recognizes the honorable member for Elizabeth.
Thank you, Mr. Speaker. Mr. Speaker, I know this mask, which was created by the quilters of the inner wheel, is quite fashionable. And I am minded of your admonition, and I will suppress any cough or sneeze that might come my way. But I want to thank the people of Elizabeth who have sent me to this place. And as I stand to second this resolution, I'm reminded that COVID-19 is changing the world that we once knew. It's a sobering thing to reflect on how the familiar has become the uncertain in just a few months, not only for the Bahamas, but for the entire world. The world is facing an unprecedented challenge which threatens to erase much of the progress gained recently. COVID-19 has profoundly affected trade, investment flows, and supply chains. And this crisis has affected human capital, interrupted our lives, disturbed our system of learning, imposed financial burdens on many, and reduced our productivity tremendously. The president of the World Bank, David Malpass, advised that if we don't move quickly to strengthen systems and resilience, the development gains of recent years can easily be lost. For now, our new norm may be daunting, particularly as we are all enduring the discomforts and annoyance of lockdowns and restrictions in movements with physical distancing from the people that we love. And to be sure, the health professionals and indeed the Ministry of Health believe that there is strong, I might say incontrovertible evidence that these measures are not only necessary, but they are effective tools in the fight to flatten the curve of COVID-19 in the Bahamas. Now, we acknowledge that some are skeptical, others are cynical, but many simply want and deserve transparency and honesty, the good, the bad, and the ugly truth, as we all collectively walk an uncharted course. There are theories in abundance, conspiracies and allegations. Indeed, there are movements now that deny the value of these measures that we are reinforcing, or who question the focus on the preservation of health and life. Some of these views are gaining traction abroad and even here at home, Mr. Speaker, that we should sacrifice the weakest and the least among us as collateral damage in this COVID-19 war. I say that as Bahamians, we are better than this. We have always been better than this. We have built a nation by lifting as we climb, by empowering those who could not crawl to first walk and then to run. We dismiss no one, even if we move a little more slowly, to carry those unable to move on their own. And in so doing, we have built a richer, gentler nation. And so 43 days after our first confirmed case, we must not lose hope. We can be encouraged, as history has shown, that in time, if we are diligent and if we do the right thing, this too shall pass. Our collective aim must be to minimize illness and death due to this novel and destructive coronavirus, while striking a balance to ensure social stability and economic solvency. This is no easy task, and it's a new paradigm for some, but it is doable to the extent that there's individual, communal, and corporate commitment to make it happen. At the same time, as we have heard, we must plan carefully and deliberately for the reopening of our economy at the right time and in the right way, with the right monitoring and evaluation. We in health believe that we can be bold and innovative if we are armed with robust evidence. The caution that we take now can lead to economic resilience and opportunities later, with fewer missteps or the need to backtrack. And I think you've heard that from the member from Kalani. Mr. Speaker, like most countries across the globe, The Bahamas has not been spared from the ravages of illness and death. As of April 26, 2020, yesterday, we have had a total of 80 confirmed cases with 11 lives lost. When I last spoke in this honorable House, we were at 29 cases. Here we are 21 days later at a 121% increase over the last report. Of the total number of cases, 22 have recovered and 47 cases remain active. Most of the cases, as may be expected, are in New Providence, accounting for 80%. Grand Bahama, and then Bimini and Cat Key considered together account for the remainder of cases with 7 and 9, respectively. Females account for 48 or 60% of all cases, although only 36% of deaths. Most cases fall in the age group of 40 to 59, although we have had one at 11 and one at 15. What is extremely notable is that Bimini has emerged as a hotspot for the COVID-19 virus in the Bahamas. Mr. Speaker, the current data in the Health Ministry supports the view that the spread of COVID-19 in the Bahamas is occurring mostly through community transmission. We have had just one imported case early in the outbreak and 4 import-related cases. The remaining 75 have all been determined to have occurred through spread of the virus within this country. Currently, 8 of the 80 cases are hospitalized in serious or critical condition at Doctors Hospital West and are carefully being attended to. I have said earlier that one of our unsung successes is that we now have a total of 22 persons who have recovered from COVID-19. And this means that they are no longer shedding virus, infecting others, and are clinically well. The case fatality ratio of the Bahamas stands, as of yesterday, at 13.8%. Case fatality ratio is a measure of the severity of a disease. It is calculated by comparing the number of cases that have died from COVID-19 to the number of confirmed cases of the disease. Notwithstanding the significant level of comorbidity that has contributed to this level of lethality, we expect the case fatality rate to fall as we liberalize the criteria for testing. More tests, more positive cases. But that will then lead to a lower case fatality rate as long as we don't have an increased number of deaths. Containment and breaking transmission has required implementation of aggressive and progressive public health measures, ranging from those that are fairly easy for the public to digest, like frequent hand washing or sanitizing, and proper respiratory hygiene, and others that are not so easy, such as domestic and international travel restrictions, mandatory curfews, and intermittent countrywide lockdowns. These best practices recommendations having been applied, they are clearly reaping benefits. And while we continue to have cases and the unfortunate deaths, we have managed to flatten the curve by having a maximum of no more than 6 cases diagnosed on any day. And our acute care institutions have not been overwhelmed with the assessment, management, and inpatient treatment of COVID cases. But we are not out of the woods yet, Mr. Speaker. We must continue the public health and social measures implemented. It is our best chance for us to make the best outcome of this unfortunate situation for all. Case identification, testing and isolation, along with aggressive contact tracing and quarantine as appropriate, are proven public health measures for controlling outbreaks. In pandemics, such as we are currently experiencing due to COVID, these measures become most important given the potential for uncontrolled spread in populations where no previous exposure, and therefore there's no one with immunity, and everybody is susceptible to infection. Mr. Speaker, case confirmation is tied to laboratory testing capacity, and in the Bahamas, significant strides continue to be made in this area. Since my last update, we have accepted 1,000 donated RT-PCR test kits, as well as more than 700 RNA extraction kits and other reagents required for testing. But despite an inventory of at least 4,000 RT-PCR kits today, we remain challenged to expand testing to reach the elusive goal of testing on demand because of international supply chain limitations. Currently, we are limited by the number of nasopharyngeal swabs in country. Our swab inventory today stands at 1,000. We are currently exploring multiple options for enhanced capacity. We have ordered and are expecting 3D printed swabs, and we have tried the validation of other means of testing, such as using sputum instead of nasopharyngeal swabs. And we have also begun the process of producing viral transport medium in the Bahamas. We shall also partner with the private sector to provide PCR testing. Very soon, persons wishing to be tested will be able to have them done at approved private labs. We are also closely monitoring the refinement of antibody tests. This weekend, we did a validation study of some 200 of these tests. As you may recall, Mr. Speaker, I advised that we would be expanding our testing protocol to include healthcare workers and caregivers of vulnerable populations, such as people that live in nursing homes, as well as others who provide health care in the homes of the elderly and ill or disabled people. I must now inform that testing priorities have temporarily shifted due to the requirement to test all healthcare worker contacts associated with the 8 confirmed cases in the med-surg ward at PMH. Additionally, with one of the cases linked to the Sandilands Rehabilitation Center, testing of potentially exposed persons at that institution is and has also been occurring. I should like to give the Bahamian people an update on that testing and on that problem. Sandilands Rehabilitation Center transferred a patient from the Robert Smith unit to the med-surg ward at PMH on April the 5th, 2020. This patient received treatment at PMH and was discharged on April 15th to the Sandilands Rehabilitation Center. Days later, the Medical Surgical Ward 2 of PMH was declared compromised on discovery of a confirmed positive COVID-19 case on that ward. And consequently, that ward was closed to new admissions. The patient of the Robert Smith unit was returned to PMH on the 19th of April to be tested for COVID-19. On the 20th of April, 2020, it was confirmed that the Robert Smith unit patient had contracted COVID-19. And this patient is now receiving care at Doctors Hospital West. Subsequently, all remaining patients on the medical surgical ward were tested for COVID-19. The remaining 39 patients at the Robert Smith unit were immediately placed in isolation and the unit sanitized. 46 staff members at Sandilands were identified for risk exposure assessment. And in total, when combined with those of PMH, more than 200 healthcare workers were in quarantine. However, we believe that upon completion of our risk assessment and testing, the number of persons remaining in quarantine will decrease. A further compounding factor are the confirmed cases on the island of Bimini, and this has of necessity resulted in screening and testing of contacts on that island, with further drawdown on scarce testing resources. To date, we have done approximately 1 1,100 RT-PCR tests in the Bahamas. At this rate, the Bahamas, with a population of approximately 390,000 persons, has been testing at a rate of 2,500 tests per million. Not the most, but climbing rapidly. For comparison, Jamaica, as of the 25th of April, has done 850 tests per million. Trinidad and Tobago, 1,080 tests per million. South Korea, 11,600 tests per million. And Brazil, 1,370 tests per million. The leader is Barbados in the English-speaking Caribbean at 4,630 tests per million. We have not abandoned our commitment to increase testing, and we are ramping up on a daily basis, Mr. Speaker. It is likely that we will receive a shipment of swabs this week. We have not abandoned our commitment to monitoring and protecting our vulnerable populations in long-term care institutions. With the emergency order of the 21st of April 2020, requiring the registration of healthcare workers going into homes to care for persons, we have started compiling a database and will be conducting a series of training sessions in areas of infection prevention and control starting today. We will also be testing those healthcare workers identified as high risk upon review. Our aim is not to hinder care of our vulnerable by removing healthcare workers, but to minimize the potential introduction of COVID-19 into the care environment of those who are most vulnerable, which we know can have devastating consequences. With increasing numbers infected leading to mushrooming contacts, traditional methods for contact identification and tracking during quarantine and isolation can be easily exhausted. With an average of anywhere between 20 to 50 contacts per case, our cumulative quarantine numbers have now reached over 800. And to this end, my ministry has almost concluded the exploration of potential technological solutions for monitoring of contacts who are in home quarantine, as well as confirmed cases with mild symptoms. We have reviewed at least 5 solutions, and as the Honorable Member for Kalani has said, we have decided which way to go. I want to let the people of the Bahamas know that while the measures being taken are unusual for our people, we are in the midst of a pandemic due to a novel virus which has now infected almost 3 million persons so far, with almost 200,000 deaths. These numbers will continue to climb, given the immune-naive status of the world. In the early stages of this outbreak, PMH was designated as the facility for assessment and testing of persons under investigation for COVID, with the repurposing of the old general practice clinic. And once testing positive, patients requiring admission would be moved to the Doctors Hospital West. I can now inform that the South Beach Health Center is now fully operational for the provision of both assessment of persons and admission of mild and moderate cases. Mr. Speaker, around the world and in the Bahamas, healthcare workers on the front line are at greatest risk for contracting COVID as they care for those already infected. We now have 15 confirmed cases among healthcare workers and 1 death. This accounts for almost 20% of all of our cases. I am pleased to say that we tested some 200 healthcare workers from PMH, and preliminarily, we have 25% of the results. None of the results are positive, meaning there is no evidence that any of those exposed persons have contracted COVID-19. It is imperative that the personal protective equipment required for provision of care to the COVID-infected, while ensuring the safety of our healthcare workers and their families, is available and accessible in optimal quantities for the delivery of this essential service. My ministry has sought to ensure adequate and sustained supplies through multiple procurement measures and ongoing receipt of donations. At this time, our stores in areas such as basic PPE kits, surgical masks, N95 and KN95 masks, visors, boot covers, and gowns is more than adequate for up to at least 1 month, and more are being procured from local and international vendors. Having the responsibility for the provision of select PPEs to other various government agencies and institutions, such as national security and other partner agencies, my ministry has spent to date more than $2 million on PPEs, and this is expected to increase by millions as time progresses. Other essential monitoring tools such as pulse oximeters are being provided, and recently we have taken possession of 6 new ventilators for our national capacity. As I conclude, Mr. Speaker, we press on, recognizing that our fight against COVID is not just a battle, but a war. We will be successful as we collectively and individually commit to doing our part to protect ourselves and those most vulnerable in our society, many on whose shoulders we stand, who have made significant contributions to our individual and collective well-being. But these measures must continue. We are not there yet, Mr. Speaker. Our focus must be on the greater public good as we pass through these trying times. Once again, we admonish the Bahamian public to apply the preventative measures to avoid contracting COVID-19. Containment and breaking transmission have required implementation of aggressive and progressive public health measures, domestic and international travel restrictions, mandatory curfews, and intermittent countrywide lockdowns. They will not last forever, but they certainly need to remain in place for now. Thank you, Mr. Speaker.
Thank you, Honorable Member. Honorable members, it has been moved and seconded that the following resolution be agreed. Whereas pursuant to Article 29, subsection 1 of the Constitution, the Governor General made a proclamation of emergency hereinafter the proclamation dated the 17th day of March 2020, declaring a state of public emergency exists in the Bahamas. Now, therefore, be it resolved that this House, A, approves the continuance of the proclamation made on the 17th day of March 2020 until the 30th day of May 2020. B, affirms the continuance in effect of the Emergency Powers COVID-19 Regulations 2020 made on the 17th day of March 2020 until the 30th day of May 2020. C, affirms the continuance in effect of the Emergency Powers COVID-19 number 2 Order 2020 made on the 23rd day of March 2020 until the 30th day of May 2020. And D, affirms the continuance in effect of the Emergency Powers COVID-19 Special Provisions Order 2020 made on the 30th day of March 2020 until the 30th day of May 2020. As many? The chair recognizes the honorable member for Cat Island, Rum Key, and San Salvador. The chair recognizes the honorable member for Bamboo Town.
Thank you, Mr. Speaker. Mr. Speaker, I rise to move the following motion. Be it resolved that the business of this House do continue beyond 1 p.m. today, April 27th, 2020. I second that.
Honorable members, it has been moved and seconded that the business of this House do extend beyond the 1 p.m. hour. As many as are in favor will remain seated. Those who oppose will stand. The business of this House will extend beyond the 1 p.m. hour today. The chair recognizes the honorable member for Cat Island, Rum Key, and San Salvador.
Thank you, Mr. Speaker. Mr. Speaker, the Prime Minister, in concluding his communications earlier, referred to the song "Abide with Me." I thought would be fitting. Since he concluded, I will start by quoting what I thought had been an appropriate thought for us today. And as I mentioned, throughout all the changing scenes of life, in trouble and in joy, the praises of my God I shall still my heart and tongue employ. There's a second voice that speaks to those who are in distress and who could be comforted by the examples we set. That's in the second verse. I'll probably refer to that later on in my contribution. Mr. Speaker, today is, we talk about the changing scenes of life, and we think about the landscape of the Bahamas and all of what I call those seminal moments that led to where we are today. I must mark that today is the 55th anniversary of Black Tuesday. That fateful day when brave warriors, courageous souls, who then were fighting another kind of virus, the pernicious gerrymandering of electoral boundaries, and those who were fighting for social justice in our country, led by Sir Lyndon Tinling, then Lyndon Tinling, who threw the mace out of that window. And that is a seminal moment that led to where we are today. And is a moment in history that perhaps was one of the keys to open the lock of the door for us to be here where we are today. As Bahamians of African descent. Let's start, I could go back to some of the other seminal moments, like out of Cat Island, we had a man called Black Vic, out of Port Howe. Yeah, we could go to Akron and speak about Little Cape or Black Cape. We could go into Zuma, Pompeii. I think, we could, then there's the Burma Road riots, the suffragette movement. What is important, Speaker? The citizen movement and committee, the Citizens Committee that was formed in 1950 with Max Thompson, that group, with Nuri and that group of persons who were protesting the fact that the government of the day refused to allow the showing of Sidney Poitier's first major movie. And in fact, it was the first major part played in a major movie by a black man. No Way Out was that movie. And I must confess, I saw it for the first time last week, thanks to the shutdown. I was scurrying through a channel trying to try something to watch, and that was on. I was able to watch that movie. That's the formation of that and that protest. And of course, it led to the strike and all that. But I stand to reflect on that moment today and to thank those courageous souls who stood against the oligarchy of that day to fight against the pernicious regime that then was in place. And I think it's that same indomitable spirit that we have. And if we go to engage that, we will defeat this virus of a battle that we now have. And so I stand to commend and pay tribute to those brave soldiers of that day that paved the way on this day 55 years ago to provide that key to the lock to allow us as African Americans to be where we are here today. And Bahamians. Huh? Bahamians, African, yeah. African Bahamians. Bahamians of African descent. Huh? So, sorry, that's what I said? I didn't say African American, I talked about Bahamians of African descent. And so I am proud to pay tribute to them today. And I think we all should do that today. Mr. Speaker, we are heading into the 6th week of curfews, lockdowns due to this COVID-19 dilemma. Like many Bahamians, I've been looking for signs that we are making positive progress in the fight against this viral threat. I heard the update by the Prime Minister, and I heard also the update by the member for Elizabeth, the Minister of Health. And I did not want to refer to Dr. Davis' academic sort of assessment of where we are and the modeling to which the Prime Minister referred to, because I think he too recognized in his assessment and what I call it the academic curve and assessment that he was engaged in, that is as good as the information that was provided. And the question really is, are we winning or losing this battle? And if you, in that same report, what Dr. Davis points out to, right, and as the member for Elizabeth confirmed, we are having increases in the spread since the lockdown. There have been increases in the death. And the same Dr. Davis measures, I wouldn't say our success, and I wouldn't say the successes of other countries, but in his modeling, he points out that the deaths in our jurisdiction compared to, say, Trinidad, to which the member Elizabeth alluded to, we have 3 times as much death. He points it out in his report. We are twice the amount of deaths when he looks at what is happening in Barbados and Jamaica. He also points out that in the 5th week, the increases in cases is up 17%. It's all in his report. If any of you didn't have it, I have a copy I could share it with you all. Right? So we are continuing to see an increase both in cases and deaths, despite the drastic measures we have asked our people to take. So as we consider this extension, I think the government has no higher obligation than to level with us about how things stand today, how they expect the next weeks and months to unfold, and when people can expect some light at the end of this tunnel. I don't know that we've gotten that yet. What the member for Elizabeth has said, which I embrace, and in fact, it is one of the things that Angela Merkel, the Chancellor of Germany, who was talking about the successes that they were achieving and what tools that she was using to do so. The first, she had 3 T's. Truth, testing, tracing. And so I'm heartened by the fact that the member who just said recognized this. And I'm heartened by the fact that he was open to say, when he realized that the message I got is the challenge is if we don't have sufficient testing kits. And we are challenged by the testing kits. And I also sense that there is some challenge with the kits that were on hand, because he indicated that there was a need to validate some of those kits, which suggests to me that there may have been some challenge. Now, if it were us, and what I would recommend, once you know where these kits are, order them or pick them up. Because yes, there is a challenge with the chain of delivery of items. And if it goes to the United States, you're not sure whether you'll get it. But there may be some challenge. And that's a global challenge, not just us. We are competing. We have friends, man. You have friends who like to get one of their jets and fly to where the testings are and pick it up, man. No, I'm suggesting that I won't post that. We're in a crisis. We're in a crisis. We've done it before. Right? Go and get it. Right? So that's what I'm saying, Mr. Speaker. And so, Mr. Speaker, let me be clear. We want this government to manage this crisis effectively and for our country to succeed in this war against this invisible enemy, COVID-19. We want success. My colleagues join me in this. We are one nation. On this part, we don't just speak it, we demonstrate it. All of our families and friends and communities are under threat. I have mourned friends, together with many of my colleagues in the FNM. Our grief is something we share. One of the last of the 2 victims was my second cousin, my first cousin's son. No, Minnis is our friend. My close cousin. We are close. Close because I care about us being successful. That I offer some of these thoughts and concerns today. Lives are on hold, Mr. Speaker. People's ability to earn a living is on hold. Things are falling apart for many of our people. No one should pretend that another week of lockdowns would somehow rid us of this virus. Nor should the public, nearly all of whom are complying with the newest restrictions, be chastised and blamed for the continued spread. The truth is that is owed to our people is that our country still lacks a really coherent strategy for mass testing. And as I said, the minister alluded to that a while ago, and there has to be an answer for that, which is a crucial component for combating the spread of the virus. And we understand, because the whole world is now competing for the same things that we need, which does a number of things. It makes it scarce, and the prices go up. We talk about gouging by our vendors here in the Bahamas. But you can hear about the gouging for these resources that's required to fight this, in prices to fight this. So we understand, but we have to be more proactive. Since we know that the virus can be spread, even by people who have no symptoms, we need testing to include them in order to stop the virus in its tracks. See, one of my friends was sick, terribly sick, and the symptoms was the virus symptoms, which is akin to the flu symptoms and the virus. And terribly sick. He recovered. His wife, unfortunately, got it. So after he had it, then he was tested to find out that he had it. His wife had it. And then again, there was a lot of breakdown in that as well. But I would not go there because that's logistics. And I'm sure I will speak to the minister about that, and we could speak to how that could be addressed at some point in time. It's a case out of Bimini, not a case out of Bimini. We need to constantly reevaluate protocols for who gets tested and how often. What percentage of the population does the government plan to test? And when will that capacity be in place? We need new resources and venues for isolating positive cases. We need additional personnel for contact tracing. And we need to be sure that our clinics and hospitals are ready for any surge in cases. Bahamians have the right to ask their government to plan for more than a week or two at a time. You know, I don't think we're asking for perfection. We're not asking for perfection. We're not asking for the government to predict a far-off future. But people have a right to expect the transparency and intelligent planning. That is especially the case when it comes to a plan to reopen our economy and to help people and businesses to begin to recover. 6 weeks in, the government's response continues to be characterized primarily by apparent short-term thinking, reactive measures, and a lack of careful planning. I'll just give you an example, so that let's say I'm picking. Just look no further than the pandemonium that was unleashed at local grocery stores when they announced the alphabetical list for shopping. Or consider the gridlock, the roadblocks on the streets when the Prime Minister indicated that we should be carrying and we should be required to produce governor-issued identification. Even the police is stopping the drivers and saying, well, I don't know why I'm doing this, but I have to see it. Yeah. So I'm saying that is what's happening now. So you could think about the questionable methodology used, again, Prime Minister. This is the methodology used to determine which businesses are deemed essential and which aren't, prompting many questions to whether we are allowing special interests to influence key decision makers in the middle of a global crisis. Let me give you an example. I know convenience stores, they sell in groceries, but they are not allowed to open. They want to know why. The vendors on Arawaki who have takeout business, they still want to know why they can't be selling their food as a takeout business. That's the point I'm trying to make. And, you know, Mr. Speaker, what I would like to remind us all of, let me remind us of one thing. All businesses are essential to the workers who rely on those jobs to feed their families. We have to remember that. The very least people can expect is to have confidence that these decisions are made carefully, without special favor, and with a full understanding of the consequences. As we move forward, It is important to note that the same social distancing policies that businesses such as Kelly's or Quality Home Center are using to safely operate during this pandemic can also be used by other businesses. The process of allowing businesses to open their doors must be rolled out in a practical but fair manner. We are seeing the uneven results of reactive piecemeal policymaking in the overly Nassau-centric approach to fighting the virus. While Bimini and Grand Bahama have been relatively neglected, despite having confirmed cases and deaths. I'll speak to the minister about that in more detail. See, throughout the months of March and April, I warned that the initially announced measures were hastily implemented and did not adequately take into account the multifaceted issues that are arising due to both the virus and the economic fallout. There's no balance, seemingly no balance. And for example, the Family Islands, we still have not addressed the Family Islands properly. Why can't the beaches in the Family Islands at least be used for recreation, for swimming? Just swimming, or exercise, sorry. I had a young man who went exercising in El Salvador. He's exercising. He told the police he didn't have. And then the other challenge with the Family Island is that they are not, the measures cannot all be found in one document. And they've been changing. And so a lot of the first residents of the Family Island are not fully aware of all because of the communication channels. And so enforcement agents in these islands ought to be given a bit more discretion. They ought to warn them first, for example, because he did not know that he could not be exercising. He told him, I'm exercising for an hour. But he was still locked up. He's on bail, has to go to court. So that's why I say, yeah, that's what's happening. I sent a note to you about it and to the Attorney General. And perhaps, and the Prime Minister, you say, not that I like to hear your voice, but at least in this time, take the call. Answer me. Yeah, answer me. Answer me. We talk about being unified. I keep telling you I'm here to help. But you got to make me feel like you want help, that you want my help. Because I called you. I'll be asking, right? Now, as the government seems to be relaxing some of its measures because of these same practical issues, a comprehensive plan is needed to keep our people safe. And these measures must be implemented very soon. The government must work to cut through the red tape and bureaucracy, produce faster results during this crucial time. We talk about leveraging technology to facilitate more effective government processes, and yet there are still widespread complaints about long delays and people being given the casual runaround when dealing with government services. Delays during times like these can be devastating to people who are struggling to stay afloat. These curfews and lockdowns are not being experienced in the same way by everyone. For many, the lockdowns themselves represent yet another threat to their health and security. Recent reports, for example, from the Crisis Center have noted an uptick in domestic abuse cases. Other media reports have mentioned robbery sprees taking place in some communities, gated communities in the province. As economic and social pressure continue to increase, conditions will not get better on these fronts. Men and women who live over the hill have complained about being harassed and even detained despite having legitimate reasons to be on the road. Such incidents may be a consequence of the harmful effects of the curfew and lockdown on persons working longer hours and undertaking tasks for which they are not adequately trained. It is time to explore and address the negative emotional impact these measures are having on our people, including the police, defense force, and our first responders, so that we may avoid any further build-up of tensions and potential fallouts in the form of domestic abuses. In other instances, Mr. Speaker, the homeless, mentally ill, are being dragged before the courts in handcuffs, and they're being severely penalized. Others have been targeted with fines that seem grossly disproportionate to the offenses they are being charged with. Mr. Speaker, we don't share the view that these people ought to be so severely, that the offense for which they're being charged and the punishment is disproportionate. And these are poor people from the inner city. You know, when you're charging a homeless man $800, you expect him to get that money from. We do not agree with the harshness of treatment. So I call on the government to renew its focus on addressing the social and economic forces that are impacting everyday men and women whose personal budgets have been stretched paper thin. This requires strengthening the social safety net, revisiting policing strategies, following through on plans for food banks and feeding networks, and doing all we can as a country to protect our at-risk population. The government must show that it will address any inequities and injustices quickly. Mr. Speaker, given that civil liberties have been suspended, Parliament must be convened on a weekly basis, or at the very least every 10 days, to provide checks and balances on proposed policies. It is through this scrutiny that we will give voice to the challenges faced by our people and help to ease their pain. The Bahamian people are hurting, Mr. Speaker. They are worried that temporary layoffs will become permanent. They are afraid that the same government that has asked business owners to have a heart may not have a heart of its own. They want some reassurance that the government has their back. The country is bracing for a severe economic decline. The Bahamian people need more than strict lockdowns and stern press conferences to survive. Our people want to see a plan for widespread testing. They want to see new protections for healthcare workers. They want to see a comprehensive recovery and reopening strategy. Our people also want to know how the government will protect the public even as the economy reopens, especially those at highest risk, like the elderly, people with high blood pressure and diabetes. Where is the plan for our people? Essential workers are on the front line, risking their lives to ensure that our country continues to function throughout this period. While it is important to honor and applaud them for their work, it is even more important to protect them. Too many of our medical personnel are falling ill. We must pull out all stops to immediately prioritize their safety. There should be no expense spared to ensure that our frontline fighters are safe in this battle. They are citizens, including students who are stuck in foreign countries, and our government has slammed the door in their face. I'm happy to hear the Prime Minister today indicate that arrangements will now be being made to bring them home, because many of them were alone and running out of money, and we were leaving them for foreigners to take care of them. So I'm happy to hear that announcement today. I would like to remind the government that the opposition remains ready to help. As a party, we have already launched an initiative to provide food care packages in communities throughout the country. And I want to thank the Ministry of Finance and the government for allowing us to bring in those food items duty free. And we appreciated that, because that was your contribution to our work. And we thank you. We are prepared to help. We are planning to do more. Yeah. That helped you. that help you. We are all in this crisis together, and the opposition is prepared to provide assistance and expertise to the government in whatever way we can. This is a time for collaboration. The more heads we put together, the more viable solutions we will develop. We must recognize that our true strength emerges when we are working together towards a common goal. We are still at the beginning of what is sure to be a very challenging time. I am so proud of how Bahamians are digging deep and pushing forward. I know that we will not only beat the situation, I know that, but we will work together to rise new heights. The solidarity, yes, I was there, but we could be home. Huh? Yeah, I'll wear that. Yeah. I'll wear my colors tomorrow. I'll wear my colors tomorrow. And as I said, Mr. Speaker, you know, I close with the second verse of through all the changing scenes of life. I speak about it. Was of his deliverance I will boast. Till all that are distressed from my example comfort them and charm their griefs to rest. Our example is what our people who are in distress need to give them comfort. And I invite us all to consider what we can do to help our people. Thank you.
Thank you, Honourable Member. As many, the Chair recognizes the Honourable Member for Centerville.
Thank you very much, Mr. Speaker, and thank you, honorable members, for the opportunity to participate in the COVID-19 resolution debate. Let me thank once again and encourage the government for their work thus far, and I am sure that the government understands that this is a bigger picture than them, and that people have an election to look forward to in 2022. Centerville appreciates the rental assistance program and your efforts as it relates to national food security. However, we do understand how politics can turn the above into a photo op and/or lip service. We will be paying close attention to both plans and would like, at some point, a report on the budgetary aspects of those plans. It is important, Mr. Speaker, to Centerville to see how much of this rental assistance program and/or food assistance program will benefit the Centerville community. Intentional leadership, Mr. Speaker, is the order of the day. Let me thank Captain Yannick Thomas, PhD, a Bahamian living in Florida, and Mr. Onisma Strawn, a Bahamian living in Arizona, for sharing their thoughts on leadership and committing themselves to the process of helping our Bahamas navigate through this. The government has indicated, and Centerville agrees, that we do need all hands on deck. Many Bahamians, Mr. Speaker, called into the show the Hit Back with Nahaja Black as they expressed their concern as it relates to the brain drain and a disregard for Bahamian talent, though talent has been tested and proven. I note, Mr. Speaker, in the Emergency Powers COVID-19 Regulations 2020, Chapter 34, Section 16, where student nurses are deemed to be registered as a registered nurse. Mr. Speaker, our healthcare system is being hit very hard, as many of our healthcare professionals are at risk and many have been quarantined. It shouldn't take, Mr. Speaker, a pandemic, however, to recognize the talents of our nurses, even while they are in training. Finally, they could get a decent salary and receive benefits of an employed person under the National Insurance Act. We need to look at the Nurses and Midwives Act and its regulations to ensure our medical facilities undergo capacity building, physical and human resources necessary for times such as this. Thank you to the community and to the constituency of Centerville for affording me this opportunity to serve them and by extension the people of the Bahamas. Centerville is pleased to announce that our COVID-19 programs are working in our community. We are reaching our people, we are speaking to them, we are addressing their needs the best we can, and most importantly, we are educating and making them more aware of the politics of inequality, the politics of health care, and the politics of a people. Hurricane Dorian and COVID-19 has brought us to a place where we have not been before and where we must reset. Our community, Mr. Speaker, has decided to take the lead in community health care and community health education. We are and will continue to encourage the registration drive with the National Health Insurance, even though it is on hold at this time. We will be petitioning the Ministry of Works to fix and ensure adequate water and sanitation as it relates to our more than 15 water and street pumps, the majority of which at this time are damaged and unsanitized. We are ensuring adequate garbage collection and environmental conscientiousness. Centerville, Mr. Speaker, is also taking the lead in our community in ensuring that our diploma program is working. We are reaching out to our 2020 graduates, Mr. Speaker, to ensure that they complete the process in order to obtain their diplomas. We want to ensure the status of their diploma, as events of the day can be distracting, when at the end of the day, they still will need a diploma. We are also building, Mr. Speaker, on an in-community convenience store program, encouraging them to stay in and buy from your community stores. The stores are only required to ensure proper protocols, social distancing, the wearing of masks, and sanitization. With more than 12 participants so far, we continue to make a difference. Mr. Speaker, I beg leave to address a release by the Cabinet yesterday with a list of individuals for the Economic Recovery Committee. Mr. Speaker, I do not say this in a negative but in a respectful way. But we continue to see the recycling of the same people over and over on these committees. The electorate clearly spoke to change, but yet in a time like this, the system reverts to same old, same old. Another committee, Mr. Speaker, and let me be very clear before I proceed. I love and I appreciate all of those individuals on the committee. I have worked with many of them throughout my career, and they all know what I stand for. It's Bahamian or nothing. It's progress or nothing. It's intentional leadership. Leadership intent on Bahamian ownership, leadership intent on change, leadership intent on the eradication of poverty and inequality in the Bahamas. Mr. Speaker, this government is recycling. This is no time for recycling. Right now, Mr. Speaker, we have an opportunity to make the Bahamas what we need it to be. No recycling. Honorary committee members, yes. Recycling, no. Everyone on this committee, Mr. Speaker, is already serving on 3 or 4 boards. Mr. Speaker, this type of recycling speaks to a disconnect and a detachment between our parliament and our people, our boardrooms and our people, back to the same old boys club. Killarney, you have to be bold. You have to be courageous. You have to be intentional. We need people to buy into this journey of recovery, and it will not happen with the same model, the same mechanisms, but expecting new and dynamic change. We need this economic recovery to come from the ground up, Mr. Speaker. Our people are hurting, our people are starving. Mr. Speaker, our people are broke. I encourage your committee, by the way, to connect with the ground, connect with the people, connect with mortgage relief, connect with Social Security, connect with our national level of education as it relates to a future for our children, connect with our farmers, our fishing industry, our natural resources. Simply, Mr. Speaker, I encourage this committee to connect with us. Where is the Bahamas Maritime Association? Where's the Natural Resources Association? Where's BAMSI? Where's the University of the Bahamas? Where's the Standards Bureau and Consumer Protection? I know it was said that this committee would be at a high level, but I think this is just too high. So high, Mr. Speaker, there appears to be no connection to the ground. Where's the ingenuity of the recycled members of your committee? We have been presented with an opportunity, Mr. Speaker, to reinforce the foundation. We should include the very ones we need to consider. So where is the representation? You said we needed to go back to farming. Where are the young, eager minds to build, produce, export our farming and our fishing industries? We play with the issue of our natural resources. Where are the young, innovative minds, our experts in marine resources? Where is the reorientation at this table? I do not question the paper qualifications of the committee members, but this, my colleague, is time for full representation and the encompassing of new industries and our most valuable resources, those that are outside and inside our country, and that's our people. Where is the connection? Mr. Speaker, I hope the Economic Recovery Committee start with all those cruise ships, by the way, that are in our waters, more than 35 of them, sitting there. Bahamians, you can go on marinetraffic.com, a live feed, to show you how many ships, tankers, and private yachts in our waters, free of charge, I have been told. If your committee is too disconnected or too high level to bring home some money to our public treasury from our natural resources, and so begins the recycling. Mr. Speaker, the number of cases and deaths in our country continues to rise. And we continue to pray for and encourage our minister, his team, and all those on the front line. I do not know what your insurances look like, but Lord knows we must look at how we are protecting our nurses, our drivers, our food store workers, our farmers, our frontliners, and their families. Only good governance, Mr. Speaker, will get us through this. This is why, Mr. Speaker, Centerville continues to ask and advocate for our people, and with no doubt, the people of the Bahamas, and with no doubt for the people of the Bahamas. The people of the Bahamas, Mr. Speaker, continues to wait for the report of the state of our public treasury committee of this House. Leadership, Mr. Speaker, intent on good governance. The people are still waiting for a report from the Public Accounts Committee. Leadership, Mr. Speaker, intent on accountability and transparency. We are waiting on an answer of a petition for the Sovereign Wealth Fund and Natural Resources and the Quieting Titles Act. Leadership, Mr. Speaker, intent on Bahamian ownership. As many of us died in the wake of Dorian, we sit and we wait for more deaths as a result of COVID-19. In light of the increase in cases and the increase in deaths, Centerville, no doubt, is in support of the new order. We need Centervillians, we need Bahamian people to wear masks. We need you to practice social distancing. We need our people to wash their hands as often as they can. Mr. Speaker, I note that many of our financial services companies, inclusive of our credit unions and trade unions for that matter, have their AGMs, their annual general meetings that are legally binding for the end of June. Many of our listed companies and organizations also fall into this category as well. Because of the legislative impact, as well as the impact of the disenfranchisement of voting members, I believe we ought to begin the discussions in this vein. This also has an impact on our capital markets, our market movement, and the state of our socioeconomic affairs of our country. Having said that, Mr. Speaker, Centerville concludes and continues to thank the people of Centerville. I continue to thank the people of Centerville for an opportunity to serve and to represent them. God bless them all, and God bless all of you members here in the House of Assembly, of course, and our people who are under attack, is what I say, with regards to the COVID-19. God bless this Honorable House of Assembly, and God bless the Commonwealth of the Bahamas. Thank you very much, Mr. Speaker.
Thank you, Honourable Member. The Chair recognizes the Honourable Member for Carmichael.
Thank you, Mr. Speaker. Speaker, the issue of water and sanitation is critical to the health of every single Bahamian, and I have previously sought to work with every member of Parliament who has standpipes in his constituency. And so, if the member for Centerville has mentioned